Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss Oklahoma's heat wave hospitalizing dozens of people, reforming the BIA health offerings in detention centers. Let's wrap things up. This is episode 145 for the week of July 25th. I'm Matt Moneypenny.
And I'm Albert Battistelli.
And before we get started, our diagnosis code for the week is W37.0, or explosion of bicycle tire. Oh my God.
The whole thing just...
This is a very, very, very violent, but also really not that violent diagnosis code. Because it's like, I mean, how much pressure is in a bicycle tire?
I think explosion is a big word for what that is. Like, is this like when you run over like a nail and it just like pops a little bit? Or is this like it has to fully, like, you put too much air into it and it just...
Yeah, I don't know. I actually heard at one point that at any time when you start pumping air into your tire, it could just, like your car tire, it could just explode randomly. There's always a chance for that to happen. And it has happened before, which that would be dangerous.
Okay, that scares the crap out of me.
Literally, every time you're pulling up to the gas station and using the air pressure, you're playing a game of Russian roulette with the tire pressure, which those has a lot more pressure than a bicycle tire.
I used to have this weird like anxiety about the airbag. Like there was like a week of driving for me where I could not stop thinking about the fact that at any moment, randomly, perhaps just from like some kind of mechanical or electrical failure, my airbag could just explode in my face. And I would drive like with my head like leaned back from the wheel a little bit. Like, I have no idea what put that in my head or why I thought about it, but it was scary for a minute.
Well, anyways, that's enough about mechanics and explosions and tire pressure.
Yeah.
First up, we have detention facility health reforms. The Interior Department overhauled the Bureau of Indian Affairs, or BIA, detention programs due to systematic problems revealed in a report obtained by the Freedom of Information Act. The study focuses on 16 in-custody deaths found. The investigation revealed that correctional officers were disbelieving inmates' health complaints. Cells weren't checked. Emergency medical care came late. Subsequent BIA investigations revealed severe negligence, such as incorrect spellings of inmates' names and a severe lack of lab tests, photographs, and interviews. The study was completed last December, but was not released publicly. In February, the Interior announced a series of detention program reforms. The Office of Justice Services Correctional Program Reform Package includes 28 items, including improving the process for conducting cell checks and responding to medical emergencies, improving recruitment, retention, training, and morale of staff, and improving coordination with other federal agencies like the Indian Health Service.
Well, it's good that they're reforming it. Unfortunate that it took all those investigations to find out all of that terrible stuff, but good to know that they're taking initiative, or I guess not initiative, but maybe.
So we're talking tribes here. This is intense. As if we didn't give them a hard enough chance before.
Right.
Now we're hitting them harder with terrible things.
Right.
Sick. Well, I don't know what else to say other than hopefully this works. I feel bad for the people that are inmates. There's always that argument of, well, they're in jail, so they don't deserve anything. Well,
no, it's not necessarily.
They're people too.
Right.
So, that's what happens.
Next up, right to access, right to fine. The OCR announced settlements with 11 covered entities to resolve claims that the providers failed to give patients timely access to their medical records in violation of HIPAA. The enforcement actions stem from OCR's Right to Access initiative, launched in 2018, designed to strengthen patient access rights across the U.S. The standard mandates that patients have the right to see and or obtain their records within 30 days or longer if an extension is filed. The latest actions bring the total number of settlements under the initiative to 38. The largest penalties were levied against Memorial Hermann Health System in Texas and ACPM Podiatry in Illinois. Memorial Hermann paid OCR $240,000 and ACPM paid $100,000. The smallest fines were paid by Danbury Psychiatric Consultants in Massachusetts at $3,500. The range in penalties reflect the nature and extent of the violations, while highlighting the importance OCR places on HIPAA right of access.
They're getting stricter, Albert.
Yes, they are.
A lot of people don't. A lot of people don't take HIPAA seriously anymore, still, or never have.
Right.
I guess it's a newer regulation. It's only been in law for like 23 years, which I guess is new. I don't know.
Yeah.
But it's hard to enforce, which is why.
Well, yeah, and this initiative was 2018, so.
Right. But now that everything is electronic, it's like, bam, you're going to get slammed with a fine. It's like, here you go. Here's an email. Give us $100,000.
Not going to get away with it, guys.
Yeah. 11 covered entities. This is a little preemptive of a HIPAA violation or breach. Which goes into our other segment, but that's okay because we can talk about it all the time. Yeah, that's the biggest takeaway is the Office of Civil Rights is getting stricter with their penalties for HIPAA violations. Dun, dun, dun. And this is evidence of that. Yep. Next up, dying of heat. Ambulance crews in Oklahoma are struggling to keep up with an increase in heat-related health emergencies. Daily temperatures continue to top 100 degrees across much of the state. In Tulsa, for example, the state's largest ambulance provider has responded to 84 heat-related illness calls and took 55 patients to hospital since July 1st. In Oklahoma City, the agency has responded to 59 calls and took 42 patients to the hospital since July 7th. Nearly all the hospitalized patients were treated for heat exhaustion, heat stroke, or heat-induced illnesses related to underlying medical conditions. Staff shortages and rising fuel prices have added to this summer's challenges. I'm going to be honest. I feel like every year some state has some sort of news report about heat-related things.
Yep.
And I don't know if you know this, Albert, but if you get closer to the equator, it gets hot. You know?
Yeah, it sure does. It's also getting really hot other places.
It is.
London this week is like insane.
Wow, fancy. Well, you know, I think that I hear that about Europe a lot too. Like France was a huge one a while back. There was I think there was the French Open tennis thing. And like they were debating whether or not anyone should play because it was hot, and then they played anyways. So heat happens in the summer, you know? That's what I got to say. If you live in the South, air conditioning is your friend.
Yes, absolutely.
Also, probably like liquid IVs.
Yeah, do that. Stay hydrated. Anything you can do.
Right.
You don't have air conditioning in your house, live in your car with the air cranked up.
Yeah, live in the basement.
Right now, but like, what are you going to do?
What are you going to do? I don't know. I don't know what to tell you. I live in the South. I don't know what you're expecting.
It's really hard.
It's like, oh my gosh, it's hot in the desert.
Yep. Weird.
Yep. Sure is. And with that, let's go to our next segment.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Welcome to Breach Patrol. We talk about the latest breaches all across the world. We already talked about one, but what else do we got?
Woo! Okay. Breaches beat Brazil. Brazil was the fourth most breached country in the world in the second quarter of 2022, according to a global data breach study produced by cybersecurity company Surfshark. With 3.2 million users breached in Q2, the report suggests Brazil has seen a 7-fold increase in leaked accounts quarter over quarter. The country also saw a 771% spike. Holy crap. A 771% spike compared to the previous quarter when the country had seen a slight improvement in its data breach situation. Brazil now ranks fourth for the number of breached users, surpassing the US, which appeared in the 5th position.
Well, you know, Brazil was fourth. The first is, as we know, the United States.
No, we're 5th.
Oh, we're 5th?
It says right there, surpassing the US, which appeared in the 5th position.
Oh, I knew that. I was just testing you, Albert. Duh, you passed.
Damn it. Darn it.
Albert passed the quiz, guys. He was paying attention to what he read. I feel like I've heard that the U.S. is number one on a different source, though, to be honest. I'm going to be honest.
Yeah, I don't know. I'm just used to saying U.S. is number one in a bunch of bad crap. So
yeah, a bunch of bad crap, a bunch of good crap. Just a bunch of crap, in general.
In general.
Well, Brazil.
That's a huge increase, Brazil. Get it together.
Yeah, I feel like, you know, I don't know what type of businesses are getting breached at Brazil. That would be an interesting thing to look at.
Rainforest.
But hopefully it's not the rainforest is getting breached.
Wow. It has been 3 years.
Several instances of tree identifying information has been breached all across the rainforest.
Mm-hmm.
More at 11. Yeah, I mean, I guess, it goes to show you that breaches happen on a global scale. Next up, email security settlement. St. Louis-based BJC Healthcare agreed to a class action lawsuit settlement to resolve allegations that its poor cybersecurity led to a May 2020 phishing attack that compromised sensitive patient data. Affected patients of the data breach took legal action against BJC Healthcare, arguing that the company could have prevented the data breach through reasonable cybersecurity measures. The company is going to reimburse class members for expenses resulting from the settlement. They're going to spend about $2.7 million to implement multi-factor authentication. Lastly, the organization will implement new policies, mandatory training, and improved password policies to protect consumer data. So number one, we talked about a HIPAA breach that happened on a healthcare organization. And then this is another HIPAA breach that happened on a healthcare organization because of a cybersecurity incident that took place.
Yeah.
So what were the two results? Well, the OCR fined the 11 entities that we talked about earlier. And now there's a class action lawsuit on the other one.
Yep.
So what that means is if you're a healthcare organization, you need to start hunkering down and get what you've been putting off from a cybersecurity perspective in place. Because I don't know about you, but I don't want to deal with a $2.7 million cost for multi-factor authentication after a lawsuit that you lost.
No.
Which is probably also close to $2.7 million because it's a class action lawsuit. We talked about that in the last episode. So, yeah.
That'd be pretty bad.
Training's important.
Okay, impersonating hacking methods. Researchers following the activities of Advanced Persistent Threat Groups, ATP, say that journalists and media organizations have remained a constant target for state-aligned actors. The adversaries are either masquerading or attacking these targets because they have unique access to non-public information that could help expand a cyber espionage operation. However, not all hackers care to put in the effort to compromise journalist accounts. Instead, some cut corners and go straight to assuming reporter personas to reach out to their targets directly. APTs are expected to continue targeting journalists using phishing attacks, malware droppers, and various social engineering tactics. Unfortunately, media organizations and their employees are open to the public and could become victims of social engineering that could lead to compromising their access to sensitive information.
What's an example of social engineering, Albert?
What?
What is an example of social engineering, Albert?
I don't know, there's a million.
Well, one of them is phishing, which is something we just talked about.
Sending a phishing email, sending a...
What a perfect segue.
Yeah.
Wow. Well, social engineering is like the number one use that hackers do.
It's true. Don't click on weird links, guys. If you get a weird email, don't do it.
Just, I don't know, just ensure that what you're getting the email from is someone that you know. And if it's not, be suspect. If it's from a newsletter, then you can click it. But if it's from a newsletter that you didn't subscribe to, unsubscribe from it and be done with it. Don't open yourself up to unnecessary vulnerabilities because you don't want to be the guy who goes to the IT department and says, hey, I found an attacker has my password and I have access to our entire system. Like that's just not good. It's no bueno.
Who you want to be.
That is what I would call no bueno, ladies and gentlemen.
No bueno.
And with that, that's it for this week's wrap up of your weekly healthcare news. I'm Matt Moneypenny.
And I'm Albert Battistelli.
And
we'll see you next week.
Thank you for listening to the Bandage Podcast produced by eTactics.